Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove. Stomach 3 is located inferior to a pupil looking directly forwards, level with the lower border of the ala nasi. To find this point, you need to stand directly in front of the person, have them look forwards, think of a line running through their pupil and coming down, and marking this point on a level with the inferior border of the ala nasi. This point is frequently just lateral to the nasolabial groove. Stomach 1 is located inferior to a pupil looking directly forwards in a depression between the eyeball and the infraorbital ridge. So to locate this point, you need to actually stand in front of the person, have them look towards you and mark your point in a depression between the bone and the eyeball itself. Gallbladder 1 is located very approximately half a cun lateral to the outer canthus of the eye. Palpate laterally to find the lateral orbital margin. Mark your point just on the edge of that orbital margin. Be careful not to move back into this fleshy area because there are other points there. Bladder 1 is located 1 fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Bladder 9 is located 1.3 cun lateral to do 17. Remember that it's 4.5 cun from the posterior midline to the mastoid process, and use this to help work out your 1.3 cun to find bladder 9. Kidney 5 is located 1 cun directly inferior to kidney 3. It is anterior and superior to the calcaneal tuberosity, which is this bone that forms the heel. Locate kidney 3, palpate down 1 cun until you find a nice cleft in the cartilage that is superior to the bone. Gallbladder 37 is located 5 cun superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Gallbladder 36 is located 7 cun superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're having difficulty locating the anterior border of the fibula, just raise the leg slightly off the bed to allow the flesh to move away from the bone. This should make it easy to locate your point.